increases that capture, and that test is good for a year. It's an accepted screening test for colorectal cancer. It doesn't give you that 10-year window that colonoscopy does, but for the next year, you know you've done that screening. Next year when you go get your flu shot, do it again.
And again, you should be getting these screenings really starting at age 50, right? 50
yes.
to 75?
There's some rare diseases or family histories that would be different. Your physician would let you know if that you were in a different subgroup, but overall the vast majority of the population is in that 50 to 75 category that they would be in the screening range.
How common is colorectal cancer?
So it's the second leading cancer diagnosis in the United States. People don't realize that. Yeah, it's really high. So very common. You know, 50,000 people die a year from colon cancer. So very important to get that screening. And the thing about this screening is if you had a positive FluFIT test and went to colonoscopy, that colonoscopy you can see precancerous polyps, the very early stages of cancer, where you're either catching it early or removing those polyps, hopefully precancerous polyps, before they go on to convert to being full-blown colon cancer. So that screening is really important for, one, preventing, but also two, early detection and treatment saves lives. So very important testing to have done.
I saw one of the stats up on the screen. I don't know if we can pull that up again, but it said there are more than 1 million survivors of colorectal cancer each
and that
year.
Really honestly is a testament to how important that screening is, because if you catch it early, it's a survivable cancer.
Wow. Now, where can you participate in these programs?
So when you go to see your primary care physician to get your flu vaccine, ask them about the FluFIT program. This is a program through American Cancer. It's something actually United Healthcare is working with the American Cancer Society and co-branding
partnership.
it there.
You're co-branding it.
Yeah. So if United Healthcare is your carrier, then your provider hopefully is participating. There's no cost to the provider or to the member to do that screening test, to do that kit and get it sent in.
Oh, that's more of an incentive too.
You know, we think it's an important screening. It's one of those preventive screening tests that we really encourage our providers to be working on getting all of our members screened. We want all of our participating members to get it done. We think it's really important.
Are most of the primary care providers in Middle Tennessee, they're pretty good about getting their patients to get a flu shot in the first place, right?
Absolutely.
So this is sort of a double whammy, if you will.
Absolutely.
Okay. So, and the idea of combining the two again is to just kill two.
Counterintuitive, doesn't it? Yeah, flu shot and colorectal cancer screening. I think the idea is you're here in the office today. You're thinking about your preventive care. You're getting this vaccine. Let's capture that moment and go ahead and get that colon cancer screening taken care of at the same time.
Do you think the mentality for a lot of people when it comes to colorectal cancer is that they are scared? They're scared to find out maybe they do have it. Like
I think there is some of that with any cancer screening. You know, I can't stress strongly enough that, boy, if you feel that way, take a deep breath and know, even if today you did have colon cancer, boy, I'd want to catch it today, not next year or next week. So again, that early detection is so important. And many people, if they have that colonoscopy or have a positive test that goes on to colonoscopy, if they've got those precancerous lesions, a lot of times they're removing those before they ever go on to be cancer.
And that's critical.
Yeah, I mean, it's just really important.
How often does a polyp, do you have numbers, the percentages of a polyp going on to become cancerous?
Yeah, there's so many different types of polyps, so it's a little hard to kind of give a number, but we clearly know there are some polyps that are prone to going on to be cancer, and so those are the types of polyps when we can get those removed before they've made that transformation. It's very, very important. I mean, it saves lives to get the screening done.
We know that some people are more prone to having polyps too. Doesn't mean they're going to go on to have cancer, but they may just produce more polyps.
And some people, if you are someone who has lots of polyps, particularly if you've had precancerous polyps, definitely talk to your doctor about what your personal screening regimen should be.
Also, a lot of people have concerns about getting a flu shot. Let's talk about the benefits of getting a flu shot.
Yeah, so there's lots of
misconceptions, aren't there, and myths?
And myth might be the right word. You know, flu vaccine is incredibly safe. We do know that the risk of flu far outweighs any risk that the vaccine has. So particularly for people who are very young or elderly, people who have lung disease or any other kind of medical issues that might predispose you to have more complications if you were to have flu. Flu vaccine is, and I realize we're talking about FluFIT today, but the flu is part of it. That flu vaccine is just really important. We've been saying for years now we're waiting for a pandemic flu season. You know, I think we really do have this kind of sense that there's potentially a bad flu season on the horizon, so we really do want to see people getting that vaccine.
Like we're due for a bad winter also,
Kind
right?
of, yeah.
I hate to say that. Okay, so FluFIT is the name of it.
Yes.
Keep that top of mind. And to learn more about this,
yeah, you can go to unitedhealthcare.com and look up FluFIT, or you go to the American Cancer Society website. They would also have information there.
also cdc.gov. All right,
Yep.
Karen Cassidy, thank you as always. Always good to see
It's
you.
good to see you too.
Great
Thanks for having me
information.
on.
Thank you. Stay healthy this
You
winter.
too.
All right, and we'll be back with a lot more right after this.